Hello, everyone. My name is Dr. Bernard Gran. I'm a board-certified neurologist, and today we're going to be talking about numbness and tingling. Numbness and tingling? Boy, that sounds simple. Well, it really isn't. The sorts of things that you look for, the sorts of things that you expect questions from a neurologist would be, first of all, what's numb? What's tingly? One arm, one leg, both legs, one arm and one leg on one side, your face. All of these things have an important clues as far as what the possible cause may be, and after that, what the possible treatment would be. Then there's the timing. How long have you had it? Is it there all the time? Does it come and go? What brings it on? What makes it go away? Things like that. Are there any associated symptoms? Numbness, tingling, but do you have weakness? Do you have pain? These are important things that you look for in terms of what could possibly be the cause, and obviously what could possibly be the treatment that follows it. We have the other parts of the medical history. Is the person a diabetic? Do they have a spine problem? Have they ever had any visual loss? Do they have any neurological diseases which may or may not have a bearing on the symptoms of numbness and tingling? If you're thinking a diabetic and they have numbness and tingling of both feet, then you start thinking of a peripheral neuropathy. If you start thinking of an older person in their 70s or 80s who has numbness in one arm and one leg on the same side, you start thinking possibly a stroke or a warning for a stroke. If you think of a young person in their 20s or 30s with the same symptoms of numbness and tingling, well, you don't really think so much of a stroke, but maybe something like multiple sclerosis. So it varies on the age group, the concomitant diseases and diagnosis that you have. When a person comes in, you examine the person. Prior to that, you take a good history and asking all the questions that I ask. And some of the answers may require further questions. So be prepared if and when you see a neurologist for this. What sorts of testing do we do? Because each type of symptom that requires further investigation. So, for example, we might need to get an MRI scan of the brain or maybe the spine, or we may need to get an electromyogram and the nerve conduction studies looking for any damage to the nerves or the muscles, which may cause the symptoms of numbness and tingling. As you can see, just because it sounds simple, numbness and tingling, it really isn't. There's a lot that goes into thinking about what could possibly be the causes, and a lot depends as to what your responses are to the questions that I asked before. So if you give a certain kind of response, the physician will go in a certain direction. If you give different responses, the physician will go in a different direction. So it's very, very important to be accurate and truthful in terms of all the questions that I asked before.